So it's been a while since I made a day in the life video. You guys have asked for it. I've been hesitant to do one just because there's a fine line between educating and then giving people insight of what the day-to-day is like and also protecting patient care. I thought it over. I'll give you some glimpses of what it's like to be a day in the life of a private practice psychiatrist. I'll also talk about what helped me to get started to have a clinic. Also, I'll give general numbers about how much income I make in the clinic and then also the costs that are built up over time and how as a provider you can what things you can do to help offset some of those costs. So when I interview patients, I'm sitting right here and the patients are sitting over there. So initially the spread out was because it was during the pandemic. You want to make sure there were 6 feet social distancing, but also as a psychiatrist it gives me closer to the exit. So if someone is like violent or aggressive, I get a chance to get out to exit faster. Now it doesn't happen often, especially in the outpatient setting. That's more a concern in the hospital setting. Also, I just have that door open because part of having an office building is sometimes the air conditioning goes out. So it's early in the morning, it's a bit colder, get the cool air in. Fortunately, I don't have air conditioning working properly this time. Now I'm going to show you a little bit what it's like from the patient's point of view. So if they're sitting here and I'm sitting there, as you can see, I try not to have too much on the walls. I mean, I do have notes that some students left me. I have some medications there that pharmaceutical reps have given me that sometimes I'll give out. But I try not to have too much on the walls here. It's almost like a blank slate, just so that the patients aren't as distracted about the environment, and so they have a better chance to focus on themselves and what it is they want to bring up. So this is probably a more accurate representation of what the patients are looking at, because I have to be on my computer here and type the notes and you just write down what's going on, send out the prescriptions while they're here. I also look at the controlled substance monitoring to see what other controlled medications patients may be on. I try to meet with the patients initially and then write the notes after, but it just takes too long. So unfortunately, I just every once in a while make eye contact and then keep my head down and just try to ensure I'm somewhat accurately recording what's going on. That's part of being a physician, is documenting the encounter. There's a cross here, and actually the hospital I work at has a cross in every room, so that's really not necessarily a bad thing. I do have a picture here that someone did a visit to the monastery and they gave me that as a gift, so I kind of want to have it in a room. I think it's just a sign from God to trust in him. Or a psychologist wanting to connect to refer me to some patients of theirs. I'm the Comcast phone guy trying to put the phone lines. I have some outstanding balances here. I have a letter of Optum Healthcare, probably about some medication interaction. Basically, I have 20-minute appointments. Typically, it's whether it's a new patient, a follow-up, I try to keep it consistent. Just because, I can't really afford to leave an hour for a patient and they don't show up, or, something happens. Unfortunate, but for the most part, it's pretty booked. Most times, patients will find me probably through their insurance, maybe through their primary care. Especially I have a brother, sister, father who all are primary care, so they'll often let their patients know this is an option. One of the most essential aspects of doing private practice is being contracted and credentialed with different insurance companies. And that can also be one of the most difficult. It can take up to several months, like 6 months, a year, to get contracted with an insurance company, if the insurance companies even do it at all. And there's a few ways you need to do to go about it. There's a website called CAQH. Basically, all the insurance companies will interact with, because it helps with the paperwork. So you, as a provider, you got to sign up for them. And then you also got to apply pretty much to each insurance company individually, whether it's United Healthcare with its Medicare, Aetna, Anthem Blue Cross, Blue Shield. So each one needs its own individual paperwork that's usually found on their website. Plus, they're often communicating with CAQH. So you need to get both things done. You could pay someone to do it for you, or you could just do it yourself. It's not that difficult. It's just it does take time. You have to be on the phone sometime with the insurance, checking in on the progress of it and so forth. Or maybe they just find me because I have a website and they find me through a website. So from 8:20 to 1, I had 14 patients scheduled. It turned out to actually be a full day. 9 of those appointments were virtual. I did the virtual appointments through the Doximity app. 4 people decided to come in person. I typically leave it up to the patients if they prefer to do virtual, 1 in person. There's 1 patient who claims that they didn't receive a phone call, they didn't receive a video call message, although sent it through the app. So whether or not that's true, was it connection issues? So I do have a no-show fee policy. I typically charge $75 if someone doesn't show up to their appointment. They need to give at least 48 hours notice in advance. Usually the first time I'll excuse it, but if it happens in the future, I do have to charge that fee. 1, to set limits, because it's kind of wastes not only the patient's time, wastes my time, other patients excuse that appointment, etc. But also it's shown to help with both medical and mental health care to have some sort of boundaries like that. Some important parts about having a private practice, having good front office help. I asked the person who's helping me in the front office now if they would agree to for the interview, but they didn't want to. But it's really important to check up on patients' voicemails, check with emails, have that patient contact, and having a good front office person really helps with that. It could also prevent from some negative reviews. Sometimes some of the negative reviews I got online is actually because the front office staff was not that well trained or didn't have that well manners, and so they weren't able to follow up on some of the issues that the patients talked about. And also, as a provider, sometimes I got to focus on evaluation, the medication process, those things. In short, having good medical or mental health assistance can really go a long way, not just for patient care, but also financially. They can help collect outstanding balances and things like that. So in the afternoon, I had 6 patients scheduled from 2 to 4. The first one didn't show up. The next 5 patients did. 4 of those came in person. 1 was virtual. Occasionally, there were some phone calls about pharmacies not getting the medications after I sent them electronically. I resend it, they don't get it again. So I just have the assistant give a verbal order to give the medications over the phone. So I also, at the end of the day, I do all the billing for all the patients that I see, just because I don't want to get caught behind. Also, there's some patients' insurances that got rejected, so I asked the staff to help troubleshoot that to see if we can get paid for those. As far as copays or cash payments, I received about $500, and then there's the other patients. I'll send them to insurances and see how much can collect from that, and so I'll wait for the reimbursements from the other insurances. There used to be a time when I initially started private practice where I was too tired to do the billing at the end of the day, but I kind of got in that habit or routine where by the end of the day I just do the billing. Also, something about what the pandemic helped with is allowing access to these virtual appointments or virtual visits. Before the pandemic, it's not something I would do, and probably caused me a lot of times to get behind with patients. So it's a little bit more taxing on patients because I have to drive to the office setting. But the virtual appointments really seem to help streamline the flow for patient care, not only for the patients, but for myself as well. So that seems to be a benefit from the pandemic. So some of the good things about being an outpatient psychiatrist is pretty flexible schedule. You can choose your own hours. If I want to work during the workday, I can. If I want to work at night, I can. If I want to do weekends, I have that flexibility. Also, when days are slow, if I anticipate it ahead enough, I can cancel that day and just have a free day there. Also, some other benefits of outpatient psychiatry is it's typically more lucrative than other settings. In the hospital setting, I get paid about $250 an hour. In the outpatient setting, I should expect to make more than that because I have overhead to pay for, the bills, the staff, etc. And so it does make more than that in an outpatient setting. In the past, before the pandemic, I wasn't really trained or experienced doing virtual visits, so I really wouldn't do that. But when the pandemic happened, it kind of forced me into doing that. Also, it helps prevent patients from doing long commutes. It also helps me to not get too delayed in between patients. And so I think that overall, the virtual appointments do help with outpatient psychiatry. Some of the cons of being an outpatient psychiatrist is, look, I'm just in this office setting all day. I'm a little bit isolated. I don't have an opportunity much to talk with other psychiatrists, other doctors, social workers, other clinical staff as like an inpatient psychiatric unit, emergency psychiatric unit, or a consult in the hospital setting. So those are some of the challenges of outpatient psychiatry. There's a lot of isolation, individual work. You're dealing a lot with administrative and bureaucratic stuff. You got to make a lot of decisions sort of on the fly, set certain boundaries. Not for everyone. You do need to have this sort of like entrepreneurial spirit a little bit, which I kind of do have at times. Also, some of the challenges is if I get sick someday, what's going to happen? Like, do I cancel all my patients or schedule them? I don't really work in a group setting where I have other psychiatrists or nurse practitioner that would, see patients, for the full day if I called in sick or something happened. So, hopefully it doesn't happen, and that is a challenge that comes up, so something to keep in mind. Other costs that come up in private practice, you have to pay for malpractice, which can run anywhere between $4,000 to $5,000 a year. Now, if you're working in a hospital setting or another psychiatric center, they'll probably pay for the malpractice for you. You're also looking to spend maybe $500 or $600 a month on the electronic medical record, and you do need an electronic medical record because nowadays almost all prescriptions have to be sent electronically to the pharmacies. You could pay someone to do the billing for you, but they may take 6%, 10% of the income that comes in as part of the cost for doing billing. Every few years, you have to get the license renewed by the state, and that's going to be another maybe $500, $1,000, depending on which state you're in. Also, if you prescribe controlled substances, and a lot of outpatient psychiatry is controlled substances, such as Adderall, Ritalin, Klonopin, Ativan, those things, then you need a DEA license. That can also be maybe about $900 every few years to renew that. Also, to get your name out there, a lot of people use psychologytoday.com, and that costs $30 a month. Also, it's pretty helpful to have a website, and that can range anywhere between $200 to $300 a year. And then also you want to be board certified. Usually that just shows you're up to date on knowledge, that you're doing all you can to make sure you have all the up-to-date knowledge to help the patients and so forth. And so that can also come with annual fees. I think maybe at least a few $100s each year. And then also if you want to be a member of certain organizations where other psychiatrists are involved with, and sometimes they have conferences or educational material, that can also range about $500 or $600 a year. Those are some of the costs in private practice. There's also paying for the building, the internet, the phone lines. But having it as a corporation, you can work with an accountant because a lot of that can be sort of a tax deductible. If you make a good amount of money, you're gonna have to pay taxes on it. But if you have a lot of costs for your business, that sort of gets also a tax break with it. I don't know exactly the details with it. That's what the accounting is for. You'd probably need to have an accountant to help run those numbers with you. But that's basically a day in the life of a outpatient psychiatrist.